Katt exposes a dark reality in Houston. What's really happening? Here's a deeper expansion of your draft, weaving in urgency, systemic inequities, and the human impact to make the narrative more compelling and expose style. Houston's silent epidemic, HIV and STIs on the rise. Houston is facing a mounting public health emergency. HIV and other sexually transmitted infections, STIs, are surging at alarming rates, disproportionately devastating communities of color. Yet, just as the crisis intensifies, prevention and treatment programs are being scaled back due to uncertain federal funding, leaving the city's most vulnerable residents stranded without care. The numbers tell a grim story. Since 2016, HIV cases have risen 17% in Houston. Syphilis cases in Harris County have exploded by 125%, signaling uncontrolled transmission. Houston's HIV rate, 21.6 to 25.6 cases per 100,000 people, is more than double the national average of 11.4. Texas overall fares poorly at 15.7, but Houston stands out with 28,000 residents living with HIV and 40,000 total STD cases. These figures aren't just statistics. They represent lives disrupted, families fractured, and communities left behind. Systemic inequities. The crisis reflects entrenched inequities. Cuts to free testing and treatment programs mean life-saving care is now out of reach for many. Communities of color bear the brunt. In Atlanta, for example, Black residents made up 71% of new HIV diagnoses in 2021, despite being only 32% of the population. Houston mirrors this disparity, underscoring how structural neglect perpetuates cycles of illness. Social stigma, poverty, and lack of access to healthcare compound the problem, silencing conversations and discouraging testing. Beyond Houston, a national pattern. Houston's crisis is not isolated. Across the U.S., cities with large minority populations are seeing similar spikes. The pattern is clear. When funding falters, marginalized communities suffer first and hardest. Public health experts warn that without intervention, Houston could become the epicenter of a broader epidemic. Human impact. Behind every number is a story. A young man denied treatment because a clinic closed, a mother unable to access prenatal HIV testing, families grappling with stigma while resources vanish. These are not failures of individuals. They are failures of systems designed to protect public health. The call for accountability. Houston's crisis demands urgent action. Restore funding for prevention and treatment programs. Expand outreach in communities of color. Confront stigma through education and advocacy. Hold policymakers accountable for neglecting a crisis that disproportionately harms the marginalized. Historical injustices cast a long shadow over today's challenges. The infamous Tuskegee experiment, which denied treatment to Black men with syphilis for decades, serves as a grim reminder of institutional betrayal. Current cuts to the CDC's HIV prevention efforts, including the April 2025 layoffs of 2,400 employees from key disease prevention centers, mirror this disregard. The proposed elimination of HIV prevention and surveillance programs in the Trump administration's 2026 budget, along with nearly $2 billion in cuts sought by House Republicans, threaten to worsen the epidemic. Experts warn that if these funding cuts proceed unchecked, the U.S. could see over 213,300 new HIV cases, 10,600 additional HIV-related deaths, and $52.4 billion in increased lifetime medical costs between 2025 and 2030. These projections come from rigorous peer-reviewed research, underscoring the gravity of the situation. Cultural factors also play a role in shaping public attitudes towards sexual health. Influential figures in entertainment, such as comedians and rappers like Katt and 50 Cent, have criticized the industry for glamorizing risky behaviors while discouraging protective measures. Controversies involving artists like Usher, Diddy, and Justin Bieber further reveal how silence and complicity can perpetuate harm. Houston's crisis is part of a broader national epidemic. Syphilis cases across the U.S. reached 207,255 in 2022, the highest since the early 1960s, with congenital syphilis cases increasing by 180% from 2018 to 2022. The conditions enabling the spread of these infections exist nationwide, and without decisive intervention, the epidemic will continue to expand. This is no longer a localized issue confined to Houston. It is a nationwide emergency fueled by institutional neglect, cultural complicity, and political indifference. The critical question is not if the crisis will spread further, it already has. The urgent challenge is whether those in power will take meaningful action to halt it and protect the health of all communities. The viral claim about Katt Williams exposing a dark reality in Houston is primarily a sensationalized framing of various tour events and past commentary. There is no single, verified dark reality he has recently exposed specific to the city in 2026. Instead, the phrase likely refers to one of the following contexts. Touring performance material, Katt Williams performed in Houston at the Toyota Center in March 2026 as part of his The Golden Age tour. His routines often focus on uncomfortable truths regarding Hollywood, politics, and social issues, which fans often describe as exposing a dark reality. The unfamous comedian incident, a recurring topic, involves a 2024 story where Williams explained a conflict in Houston involving an unfamous comedian who was angry over a payment check for a show Katt wasn't even present for at the time. Astroworld commentary. Williams has previously been praised for pausing a Houston show to help a fainted audience member, explicitly citing the Astroworld Festival tragedy as a reason to be vigilant about crowd safety in the city. Wider industry accusations. Much of the dark reality buzz stems from his 2024 Club Shay Shay interview and his 2026 Netflix special, The Last Report, where he makes broad allegations about humiliation rituals and gatekeeping in the entertainment industry. Currently, Williams is continuing his Spring 26 comedy tour, with his most recent performance on April 24, 2026, at the Lycora Center in Philadelphia.